Welcome to the Everyday Practices Dental Podcast. I'm Regan Robertson, and my co-host, Dr. Chad Johnson, Dr. Maggie Augustyn, and I are on a mission to share the stories of everyday dentists who generate extraordinary results using practical, proven methods you can take into your own dental practice. If you are ready to reclaim your time so you can focus on great patient care without sacrificing yourself along the way, buckle up and listen in.
The biggest one is software vendors who just want to clearly violating the information blocking rule. And every time you say no to giving one instance of data, there's a fine of up to $1 million. So we're talking software companies that could have paid $500 million or $1 billion of fines to the federal government. And that's happening to me on a weekly basis.
Hi, listeners. This is Maggie Augustyn along with your co-host Regan Robertson and Chad Johnson on Everyday Practices Dental Podcasts. We are here and we are hosting a very special guest, someone that I admire greatly and have the honor of introducing to you, Dr. Bryan Laskin, who is an eternal entrepreneur. He is a Minnesota-based dentist whose mind just does not stop. He is an innovator, and he is an entrepreneur. He is a genius, and he knows a lot about technology and how technology applies in the area of dentistry, but more so, he is fascinated with data. He's fascinated with the protection of data. He understands who owns data in the space of dentistry. I could go on about all of his inventions. We'd probably spend half the podcast talking about that. Currently, he is in the role of owning, I believe, he is the CEO, if I understand that correctly, of Tooth Apps, which I would like for him to talk a little bit more about throughout this podcast. But hello, everybody. And Dr. Laskin or Bryan, tell me just a little bit more about who you are and how you've ended up in this role of being a leader in understanding data and how it applies in the world of dentistry.
Well, thank you very much, and thanks. I don't want to say anything because I just wanted you to keep going on.
That's right.
Well,
Oh, and I
appreciate
can.
it. Yeah, thank you. Yes, that was appreciate that. Starting off, I'm a dentist, right? Like you mentioned, I practiced dentistry for over 20 years. Did a lot with CAD/CAM, CT imaging, as we were talking a little bit about. But then I started developing technology of our own, and the first product we created was a patient engagement solution that ended up in over 30,000 dental practices when I sold it a few years ago. And I like to say that that system I basically built to solve problems in my practices. And then as we were scaling the products called Opera DDS, uh, as we were scaling that, recognized some fundamental flaws in how our technology is handled in dentistry. I don't think it's a controversial thing to say that technology in dentistry, particularly I'm not talking about the clinical technology, but the systems that run our practices are essentially archaic garbage, right? And there's reasons why. The reasons and I wrote a whole book about why that happens, but I saw it firsthand as I was developing technology in the space. And what happens is that we have these systems that were typically developed by a software engineer in the 80s or 90s called practice management softwares that essentially tried to take a paper chart, put it on a computer, and then add some functions. But essentially, that's all they do still to this day. And they're all proprietary, meaning that, if you have that information in there, there's no way to get it out. And so what we've been working on for the last few years is developing a connector that can connect to any system in dentistry. Then we've written standards through the ADA and through an organization that helped lead the creation of Dental Standards Institute to normalize data and then make it available to those people that need it. So, at Opera DDS, we had a very popular paperless forms product, and then the most popular practice management software, they wouldn't let us write back to the medical history. Is we could not write back if somebody said that they had diabetes, we could not write it back in the practice management software. Not because it wasn't technically possible, because they made a business decision that their forms were so bad that the only way that they could sell them was by blocking other people out of their software, right? That put millions and millions of patients at risk. Okay, that's why that's why I've been focused on this. And if you know, we can unpeel this onion as much as you want today, but when you get down to it, the dental record information, the electronic dental record information is legally owned by patients, and we as dentists are stewards of this data. And we can't even do our job as dentists to protect our patients because we don't have access to this information, let alone patients having access to it. Now, what we've done is we've built a whole bunch of features and stuff on top of the fact that we can get access and normalize this data analytics, new ways to do patient engagement. But at our core, what we're doing is solving the problem of data access and interoperability, connecting dentistry to medicine, connecting to different systems. And so that's a little bit kind of how I got on this journey.
I was completely ignorant about many, many of these things when I first met you, and serendipitously, I sat next to you at a Smile Source meeting and started to share with you some of the issues that I was having with a company that I was working with, and I was trying to get out of a relationship with them, and we'll talk a little bit more about that later. But I had no idea that these were the things that we were dealing with, that I was dealing with within my practice. Um, and that they were things that were going unsolved. I also had forgotten, and was reminded of not too long ago, really what HIPAA stood for, because I just understood HIPAA as being unable to disclose information about a patient, right? But so then I needed to speak to an attorney about this particular issue that I was having, and then I was reminded what HIPAA actually stood for. Chad, do you remember exactly what HIPAA stands for? I don't mean to, like, put you
No,
on
I'll
display.
give it a go. Health Information Portability and Accountability Act.
Yes,
You're in the top 1%, my friend, right there.
Hey!
but do you know what that means?
Yes and no. I mean, it's a large volume of information, and I think we boil it down to a one sheet synopsis for people to understand. But at the same time, do I understand all of its implications? No. No. I mean, the
Right.
quickest answer is no, because
Yeah.
I think I could, if someone said, well, what about page 1998? And I'd be like, oh yeah, I don't know that one. Haha, caught you. You don't actually know it.
Yeah.
No, I don't.
Brian, take us home.
Yeah.
What does HIPAA mean?
So I totally hear where you're coming from about the complexities, right? But we're not. This is how bad this is. Meaning, how much under our nose this pervasive problem has been that we've ignored. You don't have to read HIPAA. You have to do exactly what you just did, was read what the acronym stands for. Health information, meaning information about your health. Portability, meaning it can go with you. Accountability Act, right? So all we're doing is, can we get information to follow along with the patient wherever that patient goes? That's what it's about. Now,
According to
Yeah.
their desires.
yeah, no, not just
Yeah.
desires, just regardless of what the patient wants, it goes around wherever the patient needs it to be. The patient shouldn't have to do
Brian,
anything.
My only
Yeah.
point being, like before that, if one doctor said, hey, I want to, send this information over, but then the patient said, whoa, 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 that's my uncle, who's that podiatrist. And I didn't tell you that you had permission to send that data over. I'm the one who owns that data. And so the HIPAA in one sense reclaimed who was the owner of that information and who got to assign the portability accessibility.
Well, I'm not an attorney, right? So
Yeah, no, I was just
You
thinking.
just play one on TV?
so my next sentence, you know, there, we could have we could have some disagreement about it. However, what now with HIPAA, you're correct, but there's another regulation that came later called the Cures Act, which has the information blocking rule, which actually bars patients from doing what you just said. If you, as a healthcare provider, need that information to provide the best care, nobody can block access to that information, including patients. So,
Okay.
so that's, it's not part of HIPAA. It is a later regulation that was
Separate.
passed in 2022.
Interesting. Okay.
But or went into effect in 2022. It
Yeah.
was passed in 2016. But that was my point. Is that it's like this is all about data getting to people to provide care. Now, HIPAA includes two rules because we don't want to just like patients' information to go on everywhere. So there's a privacy rule and a security rule that as we share information, we keep it secure and private. That's the only thing that any HIPAA trainer I've ever heard talk about in dentistry talks about.
Right.
All of us have HIPAA trainers come to yammer at us for 8 of the most boring hours of our life every year, right? To talk about HIPAA. And I say that because we actually created a meeting because I was so bored in HIPAA. We created a day called the Get It Done Day where I just would tell people, okay, come in, get all your regulation stuff done, and just make sure it doesn't suck, right? Because most of this is like watching paint dry. But they don't even talk about what the title means, right? That's how bad it is in dentistry right now. So sorry, it's a little bit of a soapbox, but
No, it's fantastic.
and those of us, everybody on this call are not alone. The actual HIPAA trainers don't even talk about the intent, the original intent that's in the title of the regulation, because we get mired down in these little details of like, oh my gosh, if I send an X-ray and I take a screenshot, so there's no like, is that patient information? It's like we get mired in these little details that we forget the fact that the whole point of this is that patients have access to their data, that we as dentists can get access to the information to provide the level of care that we need. We act like a new patient comes in and we get a print off of 4 bite wings from 6 months ago, and we think that we can provide the best level of care. Whereas when we have a dentist, when we have a patient in our practices and they present with an issue, the first thing we do is we look at the history of that tooth, right?
Yeah.
So,
And so we collect so much data now. And back in the day, it was just paper charts, right? And then there were impressions, and then maybe we took and we kept the stone models. Maybe we didn't, right? Today, everything is digital. The scans are digital. But then there's more. There's phone calls, and you communicate with the patient. It's a record of an appointment. It's not an appointment, but it's a record of communication and giving advice that is on that phone call. There's text messages. There's CT scans. There's lab information. I mean, data about how you're treating a patient, how you're choosing to go in a certain direction is everywhere. And the question is, who owns that? Who owns that data? Who owns the scan that you take on a patient? Who owns the STL file for the, for the implant surgical guide? Who owns any of that? Can the patient request that? And I heard you record a podcast about the projects that you're working on, and your desire is for the patient to be able to get this information and to take it from dentist to dentist, right? From provider to provider, because how incredible would life be for them to be able to take a file of their last crown, or even to have a scan of their last crown available for us to see. And gosh, what did that prep look like? If we have to replace a crown on that patient, what was that prep like? Why did that crown come up? There's a lot of information that could be available to us at our fingertips as we're treatment planning this patient.
yeah,
Who owns that data? Who
Yeah.
owns the STL files?
I mean, so when we're talking about STL files, it is a little nuanced because, and I should start out by saying when we answer these questions, how we answer them is important, right? If I just tell you my opinion, it's my opinion. If I codify it into our application, then it's proprietary information that nobody else can get access to, and we're just another problem, frankly, right? So what we've decided to do is go through the open forum of standard development, which means that you go assemble people in the room who hopefully know what they're talking about, and we discuss this and we come up with answers. Not saying we're right, but at least it's an open forum that anybody can give insight into. And then there's a voting process, and then that gets published, and we develop standards. And we actually, one of the things we talked about, Maggie, is exactly what you talked about. When it comes to an STL file, what is part of the electronic dental record? Because the electronic dental record is owned by the patient. There's no disputing that. That's the patient's data. And we as dentists have rights and responsibilities associated with that electronic dental record. So what we came up with, I happen to agree with, but we could always go back and have more discussion about it, is that prep tooth that you mentioned, that scan is actually property of the patient. It's a scan of the patient's tooth. However, the restoration that gets designed is not property of the patient. So the dentist can have that, or the laboratory, right? But that does not need to be part of the electronic dental record, because what you've done then is you've actually created something new based on this STL file.
That's like your artwork.
Yeah. Yeah. And so that you as a dentist don't need to give patients their crown design, but legally, ethically, and morally, I would say, you do have to give them access to their prepped tooth. And this isn't pie in the sky technology someday you can do. We've actually built this out so that there is a mobile application for patients to download, and you can actually export and import, and in many cases, automate this workflow. So what we're trying to do is basically help these companies that aren't complying with the regulations and the way the world works, where patients have access to the data, to be able to make it easy for them to plug in and give patients access and dental practices access.
Bryan, I've been asking for this for 27 years. So I was around a group of really what would be like an incubator startup kind of tech world, what we would call it to that today. And that was a problem that got kicked around as something to solve. I figured by now, 27 years later, it would be completely resolved. And I'm shocked to hear why not. But also in an ignorant sort of way, you just kind of made me like the light bulb go on. Is this why it can take so long when you request your medical records? Like, to me, it would be easy. You've got a file, you've got my information in there. In a week, I would expect to get it, and that's not the case at all, or at least it hasn't been for me. So is that part of that? It's not sure what to exactly give. There's no standard for it, and maybe fragmented systems on how it's stored. I mean, I guess I just expected after that many time that we would be beyond this problem.
Well, you mentioned, are you talking about the medical record or
Yeah,
dental
well,
record?
medical records specifically comes to mind, but just in general, when you request records, I guess I would imagine it in most practices to be something that would be electronic and instantaneous. And in some cases it is, but then in other cases it is not.
Yeah, I think, I like to say medicine and dentistry are messed up in different ways, right? And because I talk with a lot of, in fact, that's going to be a big focus of my podcast going forward, is we're going to bring on physicians to talk about this, because as right now there's it's called MDI, medical dental integration, or medical dental connection, and it's called different things, but there's a big push within dentistry to work more closely with our medical colleagues, which I totally agree with.
Me
How would you-
too.
but we need to do it in a meaningful way, right? Because they're messed up, right? We're messed up, but they're also messed up. And if we take our industry and put it on the medical machine, it's not going to go good. It's not going to go well for dental patients, dental practices. This could be, I mean, we have to do this meaningfully in my mind. So let's talk about what those differences are. And so when we're talking about the medical record access by patients and the dental record access, it's two different worlds. They've been working on medical interoperability or data exchange for the last 20 years. And there's all sorts of problems with it. Regionality, there's massive companies like Epic and Oracle that are fighting battles, and all sorts of stuff going on that lead to the problems that you're discussing.
Which,
Uh,
hold up, those aren't even medical companies proper, right? I mean, those are just data companies.
Correct.
Yep.
Those are software companies
Yep.
that have data. You're right.
Yep.
Which is its own problem, right? Meanwhile, on the dental side, nobody's done anything except for us for the last 3 years, right? And not these aren't software companies. These are typically distribution companies or some company that bought another company. It's a PE group that just bought a software company and doesn't even know how to innovate and do anything. So all they're trying to do is milk this cash cow until it dies, right? Two totally different problems, but at the end result as a patient, you're getting hosed in both instances. I would argue today worse on the dental side, but it's so much easier to fix because nobody's done anything. So what we've tried to do is come in, write standards, learning from the medical mistakes. Second mouse gets the cheese, and create technology that we can solve the problem holistically in dentistry that then we can actually apply to medicine and help solve some of their problems too. That's in a nutshell. That's what the mission for Tooth Apps is.
Bryan, what fuels your passion for this? Why does this matter to you? Other than it's a fun problem to solve.
Well, I've been called an impact junkie. And so the bigger impact, the better. The harder the problem, the more I like it. And if it involves a fight, then I'm really down. And this checked all the boxes for me. So it's something I could not go away from, right? And then we're fighting against some things that I just think are philosophically wrong. Frankly, I sold my dental practices after 20 years of 25% year over year growth was the least we grew. I sold my software, my last technology partner company. And so I was like, when I was looking at this problem, I literally thought, what's the biggest problem I can help solve? I'm in a unique position to solve. And then I couldn't think of anybody else that would do it. Frankly, that's why I'm really passionate about it. I don't know. I mean, now there might be, but back 3 years ago, I couldn't think of anybody else that was actually going to work on this problem. That's why I'm passionate about it.
So let's
What
talk. Go ahead.
Oh, I was just going to ask, what is the biggest frustration that you've hit your head against the wall in this particular quest that you've
You're
undertaken?
gonna get me. I'm gonna get mad talking about that. But there's been a few. So I can't just pick one. The biggest one is software vendors who just want to just clearly violating the information blocking rule. And every time you say no to giving one instance of data, there's a fine of up to $1 million. So we're talking software companies that could have paid $500 million or $1 billion of fines to the federal government. Then that's happening to me on a weekly basis. The other instance is dental practices when I talk to them and they say, Bryan, we don't want to give patients their treatment plans because then they might go somewhere else. And I think, do you suck so bad at your job that you think they're going to go somewhere else if you actually tell patients what you're planning to do for them? And I don't know which is worse, but I literally every week I hear both. And so that's been my biggest frustration.
I appreciate you sharing that because I genuinely was super, super curious about that. And I'm glad you brought it up, dentists being afraid or fearful to give away that information. And I've requested my own records in the past, dental, medical, otherwise. I'll leave it anonymous, but I could tell in the response back to me, they never said no, but it was, well, why? And it was just a really curious, but also tinged with that, are you leaving me feeling? And I thought, oh gosh, no, of course not. But there was that human element to it. But I didn't think you have to, right? You have to legally give someone their information if they ask for it.
You don't have to, but there are consequences if you don't. Right.
Okay.
Uh,
Okay. Well
right,
said.
yeah.
Well said.
Yeah. It's like, because the reason I say it, people say, well, where are the fines? I've said, they say, well, I don't think I'm going to do this. I go, that's fine. You can steal a car as long as nobody comes after you. You didn't get in trouble. Doesn't mean it wasn't illegal. Right. Yeah. And one of my favorite quotes is by Rick Rubin, the music producer, who says, the best art divides the audience. When I talk about this, one of two things happens, right? Dentist company, they go, oh, thank you so much. My aunt just had a knee replacement and we couldn't figure out we couldn't get her records to go see, and they understand the problem in healthcare. They see it from the patient's perspective. Or they start saying, what are you talking about? My software platform, my practice management software, people could leave me and go to another one. To which I say, you have 1% of the industry. Are you worried about losing your 1% or getting part of the other 99? And very often, clearly the answer is they're worried about losing their 1% because their software is so bad. And so, that's kind of what's going on. There's not, nobody goes, nobody feels, well, okay, this is kind of going on. It definitely divides the audience when you tell them that patients should have access to their data, for sure.
Mm.
Let's talk about a fight, and let's talk about feeling that fire, because recently when you and I met, there's a fire in me, and there's still a fire in me. And I had a relationship with a company that was working with our phones, and I started this relationship in 2017, 2016. And it was a great solution. It was a way for us to get our phones connected to EagleSoft, and the calls were recorded. We could go back and we can listen to them. There was a lot of information there. Um, and it was a really great solution. And we were in a relationship with them up until this year. But then there came other companies onto the market that provided a similar system. And I wanted to investigate that because they had a different way of communicating with some of the other um, uh, technologies that we were using in the office. And they were also less expensive. But I could not get out of my relationship with this company. And they rhyme with sleeve. Um, or yeah, sleeve or sleaze or whatever you have, right? And that was bad. But let's leave it in there. Uh, because they refuse to give me my data. Yes, you can leave, but there's no way for us to give you there's no way for us to give you the call recordings or the text messages or anything like that. You could leave, but you could leave without your data. And I stayed because I really wanted to hang on to those call recordings. There's a lot of information there. There's the mood of the patient. There is the threats of I'm going to sue you. There's a lot of information on there that I didn't want to lose, that I felt was in some way protecting me. Until finally this year, um, I went to them and I had talked to you, and they said, we will give you your information, including your call recordings. But every time I would talk to a representative of this company, every other sentence, maybe not sentence, but paragraph, was, could you please stay with us? Even after my very, very long monologues of there is nothing in this world that you could do to keep me because of the unethical practices that you have been, you know, because of the way that you have interacted with me for the last almost 10 years. I just I don't work with companies like yours. And so through this very, very long process of separating myself with them and them promising to give me back my data. Unfortunately, I was always on their Zoom calls, so none of this was recorded other than, me taking some notes, or my office manager having a recollection of this. We ended up signing a contract with Mango to move into their services. And then finally, when it came time to sever our relationship, they said, we can't give you your recorded calls. And I said, well, what do you mean? But you said that you would. And they said, yeah, no, you must have misheard that. And so I ended up posting something on social media presenting this information. And they posted on social media, don't worry, we'll take care of you. And they ended up sending me another email saying, we will give you your recorded data. And I ended up talking to an attorney and trying to figure out whether or not I can get my recorded data, and kind of went back and forth to find out that that it's probably the only way for me to do that is through a lawsuit. That would probably cost me anywhere up to $1 million. Um, and as soon as we kind of made any more movement after that email where they said that they would give me my recorded data once more, they came back and they gave me a link to download the data. Of course, there were no recorded calls on that data. And then, again, I said, can I have my recorded data? And then they said, that is unfeasible. And then I said, but this is information blocking. And they said, it's not information blocking if it is not feasible. I talked to another company that does the exact same thing, which is PBM, practice by numbers. They do exact same thing. They record calls. They offer phones. And I said, do you release recorded calls to the clients that are leaving your company? She said, absolutely. That's Aditi Agrawal, who's also a dentist that invented that company. I absolutely release data. I said, how hard is it? It's not hard at all. You go on the server, you hire an engineer to get your data, and we release that to you. And so it's made me extremely angry. But the entire time they kept offering, please, will you stay with Sleeve? You can keep your data for a monthly fee of this much. We just can't. It is unfeasible for us to release this data for me, which boggles my mind. How is it possible for you to not be able to give me a recording? I mean, at first it was like, oh, the data's too large. What world do you live in that data is too large for you to transfer?
Right.
Have you not heard of Dropbox? I mean, and so I was given a choice, right, to stay with Sleeve and pay a monthly payment to get a hold of my data, which my integrity just prevents me from giving them a single penny, to possibly sue them and go and take a whole bunch of my retirement savings and try and wrestle that away from them, or to walk away with this fire that's still burning, this incredible anger at this unethical company that does this to me. And they have done it to many, many, many dentists, because I've heard from many dentists that they have done this to. I don't know what the solution here is, because this company goes to dentists and just flat out lies about what they can have and what they're willing to give on the back end as they're severing the relationship, as they did to me.
Yeah, I do know what the solution is. I mean, and we're working on the solution. We're developing a coalition of software vendors that believe in open data in dentistry. We're going to be doing a convening this summer in Washington to push for some certain things. Getting, high on my mind is getting patients access to their data, because, like you mentioned, the recordings. I don't know, depending on the recordings, if that's part of the electronic dental record or not. Certainly, some of those text messages probably are. I would argue that it's the patient's data, and patients should have access to it. And unless they're delivering that through a secure mobile application, which they're probably not, those all the companies who believe in open access don't even fully understand what that means, right? So we're putting together a coalition to kind of educate the industry, and we're going to be coming out with certifications and things to kind of so that, because right now, let's face it, the software landscape in dentistry is the Wild West. It's just lawlessness completely. And we are in the weird position of being a disruptor by trying to lay laws down versus break them, right? We are trying to create standards and laws that by all accounts should already be in place, but nobody's following them. So it kind of puts us in a weird position to be the sheriff in town and trying to get these behemoths who, I mean, there are some massive companies that are just illegally stealing and reselling data. And what no dentist says when they sign up for a phone system, a patient engagement solution, they don't ask, how do you get the patient's information? Nobody asks that, because nobody even knows about the problem of companies hacking into integrators, illegally stealing the patient's information and reselling it. So there's so many, we could go deep into in a nerdum of a wizarding world of lawlessness, of nerddom that probably would put people to sleep. But the end
Tell me about
reality
that
is
though.
here.
Hold on. Are dentists implicitly getting data that has been procured illegally?
Oh, 100%. Yes, there's companies out there doing that right now, and they have big booths in trade shows, and nobody asks, "Oh, gee, are you actually how are you obtaining this information?" Right? Because you
You
have to,
could buy other
right?
patients. Could
Oh,
you
yeah.
explain that? Because I don't
Yeah.
even.
So, here's the common practice of how the average technology company integrates with the practice management software. Okay, there's a couple different ways. One is you can go to the company and say, "Hey, I want to integrate with your practice management software," and then they say, "Great, here's our API that you can plug into," and they charge your company for that. Okay, the X amount or whatever, and and most of them don't ask the question, do you have a medical necessity to have that information? They just say, how much do you want to pay us? And the more you pay us, the more information you get. That's it. So that's the most lawful way that it tends to be going on now. Then there's companies that are like, well, this is a or and by the way, these are large companies. And if you're a small technology company, you don't probably won't pay them enough for them to even talk to you, right? Then on the other side, because there's a bunch of companies that they won't talk to, the companies have have sprung up that say they built their own roads who'll get into the practice management data, pull it out and resell it to companies. And nobody talks about this in dentistry, you know, but that's kind of what's going on. So it's either knowing and unknowingly illegally blocking information, or it's getting it in sketchy formats and reselling it. And what we're trying to do is because when you plug into these systems, everyone's unique. You know, if you look at something like Dentrix that's had God knows how many iterations, that alone probably has 10 different connectors for the 10 different versions of it that have been throughout the years of Dentrix, right? So if you're a small developer to get to integrate with people's practice management software, you have to build 15, 20, 30 connectors that all suck, by the way. These are all bad connections that don't comply with that aren't very good, and that you have to, as a small company, a big part of your job is connecting to these piles of garbage, right? What we're trying to do is replace all of that with a standard called API or programmatic interface for any company that needs to have the information, that can show they need to have the information to plug in and get it with a single connection for all of dentistry, right? And so it's not directly what the sleeve company, but if they had adhered to the standards and regulations that are, you know, some are mandated by the federal government for all of healthcare, including dentistry, and some are new ones, and some are just ones that we should do because it kind of makes sense, right?
What's been the response?
It depends who you talk to, right? I mean, software vendors think it's great, but they kind of like, can you actually do this? And because we haven't solved every problem, but what I can tell you is we're the only one really solving the problem in this way. So we have made a ton of progress. I hadn't heard the term interoperability in dentistry. And when I wrote a book about it 3 years ago, right? But now it's becoming a thing. You know, great people like you recognize the problem, have me on the podcast talking about it. So we're spreading the word, doing convening in Washington. We're putting pressure. Our next step as a company is we're going to go directly to patients. So patients are going to be able to request the records directly, and then dentists they'll get educated pretty quick. When you get 10 patients request their records through a mobile application, right? You'll probably figure this out pretty fast. So that's what we're doing as a company to try to move the tide. You know, standards and regulation, talking to dentists, you know, through the podcast, through books, whatever, and then going directly to patient. And there's large companies that, you know, one of the large PMS vendors has a list approved, approval pending, unauthorized/dangerous on their website. Okay. And so I bet you can guess what gets you on the dangerous list and how you go to be authorized. There's one criteria. It involves a pen and a check, right? So, I mean, so companies who are on the danger list are calling me up going, we need to solve this problem because they're on the danger list because they don't want to pay it, right? So we are having momentum, but, you know, I'm an impatient guy, so I want it to go faster.
Hmm.
Have you had difficulty yourself? Is that part of the reason, other than it being a great injustice and being a very enticing problem to solve?
Yeah, that's how I identified this problem was through scaling the patient engagement solution, talking to the PMS vendors. Uh, it was just, I mean, problematic, but we were able to solve for it in most instances. But when I sold that platform, and even before I was sold that, I was trying to think of like what's the next big challenge, and I was like, this is just a mess, right? So I have had experience from the perspective of a technology developer. Also, I'm involved in a lot of different startups. I'm part of about 15 different technology startups in dentistry, and so if you're going to be doing something in dentistry and this is a big problem for every company that's trying to solve problems in dentistry. And not everyone, if you're creating the next generation of composite, you don't need to have access to the patient's information necessarily. But for if you're an AI company, if you're doing anything that's
Data
associated with
mining.
patient, yeah, any research, right? It's a big deal. And so yeah, that's a long answer to your
Well,
short question.
it feels like a volcano. No, you answered it great. It feels like a volcano that's sitting somewhat dormant. And think back to like the housing crisis in 2008, right leading up to that, the big surge, the big wave, the lava, whatever, metaphor you want to share. I remember being approved for an enormous mortgage, and I think I was making, like, I don't know, it was like $11 an hour, something crazy small, and thinking, this doesn't, like, even on the most basic level, make financial sense. Like, why am I getting approved for that? But everybody was doing it, and I can see how this sort of lawlessness, or maybe the lack of attention from law on these things, how this happens. If I'm a dentist, since I've got 3 dentists here. What is the first step that a dentist needs to take? Because likely there's a level of ignorance of not being fully aware, other than experiencing it like yourself and the frustration from it. Where does one start?
Well, I'm a little biased, right?
Obviously, a little.
Right, yeah. So I would say making sure your patients can get access to their data through a secure mobile application, because here's the reality is that that's where your liability lies. The what happened, because if a patient requests their records and you cannot give it to them through a secure, if they say, I'd like my, you know, and again, it's only if the patient complains, right? But if they know their rights, which is that if they request their records through a secure mobile application, you need to be able to deliver that in a machine readable format. Like, and there's a lot of detail here, right? So, uh, uh, I would, and by the way, the patient doesn't care that it's the practice management system that's the problem, right? They're going to come to you, and specifically the person behind the front desk that's overwhelmed, complaining about this, right? And so that's where I would start, making sure that my patients aren't going to be pissed that I can't give them their information when they start learning about this.
So
Mhm.
are you saying that the data that they request has to be them has to be that it has to be requested via an app, or it has to be delivered via an app?
It has to be delivered in the format that the patient wants, including a secure mobile application. So if they say, I want to have a bunch of PDFs printed off and 1,000 pieces of paper, which they won't, right? Then you have to deliver it in that format. That you probably could just do it through a secure mobile application, but it specifically states. Let me describe why. The reason why the 21st Century Cures Act, which includes the information blocking rule, came to be. Patients were looking to, to get their medical records, and physicians said, "Well, we can't do it. They're all locked up in Epic." And Epic said, "Well, too bad. We're not covered under HIPAA," which they were right. So the federal government wrote a piece of legislation, the 21st Century Cures Act, to fix that issue, such that that is why MyChart exists. If you know the product MyChart. MyChart was not created because Epic loves people and wants them to have access to their data. MyChart was created because the federal government forced them to. The problem is nobody's been paying attention in dentistry. We have the same mandates to have a MyChart, and that's what we've built. It's now called CAIR, CAIR. We're rebranding it. That is going the way that patients get access to their data, and then patients can. But the reality is that this really isn't about the stick, right? It's not about it, you know, if you've used MyChart or if you've used these records, you're going to be way more informed as a patient. And I think it's going to be the biggest increase in case acceptance since the intraoral camera. When patients can see their intraoral photos, they can get third-party financing, do online scheduling, all through a secure mobile application. They can message you, instead of that being through a phone system, it'll be through the secure mobile application. And by the way, it doesn't matter which systems you're using. If you use like a Mango Voice, they're a partner of ours. You can do your text messaging and it can show up in our platform securely, stuff like that. So that's where I would start, is making sure, because that's where you're likely to get dinged as a practice, is if a patient says, I'd like my complete records, making sure that you can actually deliver that.
Except you can no longer start writing patient was a complete jerk, was totally disrespectful. Like you can't put that in a patient chart anymore.
Sure you can.
And
Not in the progress notes. Oh, you can. I wouldn't do it. But, if the patient's then you're just telling the truth, right?
But darn right.
Yeah.
I'm seeing that I understand now the B2C connection, why you want to go straight to the patient and empower the patient to drive the change. Your episode, I think your podcast called Patient First Podcast, right? And you have a recent episode with Frank Lobb. I'm only like 15 minutes into the interview, but it's incredible. And Frank is talking insurance and healthcare. And there's so much about that world that I am not aware of myself, that I feel. And I've asked multiple like providers. I've been like, it would be so cool, if you had a class on it and you could help empower people. But what if, like, follow me here, what if we were able to take that kind of fear mindset of I don't want people to leave and switch it around so that it's an empowerment? Like, because you are with me, you get this access. I have put in the work for you because you know why? We are in this together. Like, to me, that's true advocacy. Like, I think of my healthcare people as my team. I have a chiropractor. I had a therapist for a long time. I have my medical doctor. I have my dentist. Like, they should all be talking. Like, maybe it's all about me. Maybe that's a selfish thing, but shouldn't they all be talking? Because there's risk factors and things that some practitioners look at that others aren't. It just makes sense. And so for me, I would feel empowered as a patient, and I know where I would be going. If we can take down these silos, I would feel like my health really does matter.
Yeah, and that's what we're focused on, right? You can't do Rome wasn't built in a day, but I do believe oral health is the gateway to overall health, and so I think it makes sense for us to go there. Yeah, absolutely.
as unexciting as HIPAA is, the idea that we could have something similar to my chart for our patients and our ability to communicate with them would be safe and protected and under our control as opposed to the control of whatever whim the company that we're working with and whomever, and then there's the idea of who owns this company today and what whim, what whim and what mood are they in to release those records or the reins or control onto us.
Well, let me interrupt you there if you don't mind, because it's not an idea; it's reality. We've already done it. It's called CARE, and it's not who it. Obviously, I'm a co-owner, so I'm 50% of the company. It's not a private equity group. My co-founder and I have had multiple exits. This is self-funded, so we're not looking to get another round and jack up the prices on people, right? Which is kind of what all those companies are doing right
And
now.
decimate quality.
Yeah, and we actually have how this information is handled is all public. It's part of the standards that we've written, right? The one how patients get access to their dental records are called THOR. It's called THOR, Transferable Holistic Oral Records. How we manage dentistry within dentistry is called ODIN, the Oral Data Interoperability Network. I'm based in Minnesota, like you said, so we like our North.
There you go.
So and we have one coming up right now. So we're if you want to get involved, hit me up. We're working right now. I'm mapping and filtering medical histories because if you look at the medical history in your practice management software, it makes no sense. So what we're doing is we're taking the medical history and then doing what they do in medicine is they actually take that comprehensive medical record and then look at what are you doing as a provider and then having you work with that medical history for the patient. So it's not onerous for you or overwhelming. And so that's what we're doing for dentistry. So instead of just having a radio button about allergies, if you're sedating patients in your practice, you'll follow the same levels of medical history. So I'm going down the rabbit hole, but that one's called HILD. It's another Norse theme. So if you want to get involved, with standard development or open data, I'm the right guy to reach out to.
That PMS that I use has a health history question, venereal disease, yes or no? And I'm like, who calls it that anymore? It's just like, but I can't change it. It's just like, nope, that's what we call it, when we made it, and we're not changing it. And that's what it's going to say. And you can't, keep things updated. It's so frustrating. What do you do?
Yeah. And so what we're trying to do is get the right people in the room to develop a medical history that, nothing's perfect, but at least that's published, that people had a public forum that they could give us feedback to, and then we can adjust it as necessary.
Yes.
Bryan, every time I talk to you or see you, I am just in awe of everything that you are. I don't know how your brain works. It makes my brain hurt, but I'm really glad that your brain works this way. I just want to offer you a heartfelt thank you for making this world spin in the right direction.
Well, right, you're doing amazing things too, and so it's right. The respect is mutual, and so thank you very much.
Thank you for joining us today. Thank you for this incredible amount of knowledge. And I mean, I think we are all looking forward to the future that you are helping us create. Check out Tooth Apps, and let's see what the next 2-3 years will bring for our patients.
Appreciate it. Thank you very much.
Thank you for listening to another episode of Everyday Practices Podcast. It would mean the world if you can help spread the word by sharing this episode with a fellow dentist and leave us a review on iTunes or Spotify. Do you have an extraordinary story you'd like to share or feedback on how we can make this podcast even more awesome? Drop us an email at podcast@productivedentist.com. And don't forget to check out our other podcasts from Productive Dentist Academy at productivedentist.com/podcasts. See you next week.